3, 2, 1. Liftoff.
Welcome to the Ketamine Startup Podcast, where we talk about anything and everything related to ketamine clinics, startups, marketing, and more. In today's episode, I had the pleasure of interviewing Dr. Glareh Imani at the annual American Society of Ketamine Physicians, Psychotherapists, and Practitioners Conference in Austin. Dr. Glareh Imani is a board-certified emergency physician in Arizona, and she has a practice, Nameen Infusion, where she incorporates IV ketamine therapy. I hope you stay tuned for this really cool podcast and learn more. Let's dive right in. Welcome to the Ketamine Startup Podcast. It's a pleasure to have you, Dr. Glareh Imani. Thank you so much for being here. And let's start about hearing from you. So tell us your background, maybe like where you grew up and where you went to college, med school. Kind of give us your background so that the listeners know a little bit more about you.
Well, Dr. Ko, thank you so much for having me here. And my background is I started out from undergrad in Texas, kind of got my degree in neuroscience. I love the neuroscience. I like just learning about it, but there wasn't much that I could do with it as long as, I stayed in it. So my passion was to do medicine. And that and first I thought I was going to be a neurologist because of that. And it turns out when I was a scribe, ER just resonated more with me. And I went to med school in Arizona, Midwestern University. And after that, I did my residency in University of Florida in Jacksonville. And I wanted to come back to Arizona. So now I live in Arizona and I have been practicing there for over 8 years. And it wasn't until I think about 2 years ago during the pandemic, I had read an article that you had written that got me excited because I've been giving ketamine for pain and sedation, mostly sedation, and kids do so well with it. And then once I started reading more about how it's helping people with depression, especially since depression has risen and suicide has gone up too. And I just started looking into it more and more. And I took a course with the Reset Ketamine or Startup Ketamine. And that just opened up a new world. It took about a year for me to open up my own clinic, but I'm very glad that I did it. Here we are.
Congratulations and kudos. And remind us the name of your clinic?
Nameen Infusion and Wellness.
And that
in
is
Goodyear, Arizona.
Awesome. Congratulations. It takes a huge effort to actually have the idea and then put it into practice. There's definitely a lot of steps in between the idea, the conception of it, and then actually delivering it. I kind of think about it as like making a baby in a way. You have the fertilization, conception process, which is kind of fun and easy to do for the most part. But then the actual labor delivery, that's challenging. So
the 9 months of carrying the baby.
Exactly.
Yes, that was the whole last year, putting everything together, figuring out what do you need for the city and looking for a place, the right place that has bathroom accessible or parking accessible. Is just so huge and something to consider beforehand.
Beautiful. And, I am curious because I love neurology. I love neuroscience, the brain. So what sparked your interest in the brain and neurology and neuroscience? Because that was your major, right?
It was. I actually started out from psych. I took an abnormal psych class and it was way too abnormal. And that would turn me off from psychology at first. And then I was chemistry, biology. I just happened to take a class in neuroscience. And this is back in 2004, 2003. That's when I actually graduated. It was in 2004 from my undergrad. And I just happened to take a course and it was brand new. There was a small class of 6 to 8 students. And it was one of the things I took the course and I was like, this is what I want to do. I want to get my neuroscience degree. And then I got my degree and I was like, oh, wait. Bachelor's of neuroscience doesn't get you anywhere.
That's fascinating.
Yeah.
When I went to college, I was really interested in consciousness and the brain.
Right.
And we didn't have a neuroscience program. It was a pretty small liberal arts college. So particularly I studied just the brain and the structures of it. And it was my senior thesis, but I didn't really have a lot of mentorship with neuroscience because I am interested in consciousness and how, is the brain creating the consciousness? Is the consciousness creating the brain? And so this is kind of an interesting question just for my personal interest. What are your thoughts on it, studying neuroscience?
I think that there's different levels for sure, because you have the consciousness, right? And then you have the subconscious, and you have it just so many different levels. And after having ketamine infusion myself, it just opened up a new world. It's just bringing up what you have been not thinking about or repressing, or something that has happened to you in the past, and just putting in the big screen and giving you a different perspective of life that has been very eye-opening for me.
So you had mentioned 2 years ago with the pandemic, that's when the idea came to be. Was there like a pivotal moment for you when you're like, you know what, I have the idea and I'm going to do it? Because a lot of people I notice, they have the idea, but they don't actually do it. So was there any transitional moments or like, yeah, that was the moment when I truly decided I'm going to do this? Or was it a gradual process for you?
It was more of a gradual process. It was one of those things that I I love ketamine. Man, it's such an amazing drug, and using different dosages of it, you can do so many different things with it. And slowly, kind of seeing it, having it done or getting it done myself was like really the mind and eye-opening point. Probably that was like, oh wow, everybody should at least try this once. Now it doesn't work for everybody, but it does help a lot of people. And that was the one thing. And having colleagues, family members that they suffer from depression, they don't want to be on the SSRIs or daily medication, it's never worked for them, the psychotherapy, just seeing them get benefit from it, or the potential of other people having the same results, really pushed me toward, what, this is something that I can provide this in a safe environment. I'm trained for it. Who better than an emergency physician who knows how to deal with all the side effects and the risks that comes with it that you have seen already? So in the right setting with the right person, it is powerful.
What were some of the most unexpected challenges that you faced, Dr. Imani, as you were setting up your ketamine clinic? Was there something that surprised you about the whole process?
Yes. Having a backup for everything, having a backup pump, backup chair, backup headphones. Because what if the headphones it doesn't work, or you forgot to charge it? So important that I learned the hard way.
Oh, yeah, totally. Yeah, I think that's a great idea. And I think we had discussed this previously. In the military, they say two is one is none. So having a backup of
Yeah.
everything is really crucial. Although we don't necessarily have a backup of ourselves.
No, not yet. If I could clone myself.
So I'm curious for those, who are listening, who may have heard of ketamine use in the operating room and the emergency department, but we're kind of delivering it in a different way. So for you and your perspective, what are some of the nuances of how it's delivered in the hospital setting versus in the outpatient clinic setting with you?
I think the hospital setting is when you're using it for anesthesia, so you can even at a very higher dose, and you want them monitored at all times, and it's just a different setting where somebody is either suffering from a broken bone, a dislocation, or there is something else going on, right? That you're doing that in rapid fire, treating them, getting them from A to B. Versus in a clinic, you're doing it in a very calm, safe setting where they're coming in, you have the room dim, wearing eye shades, they're listening to music. Right. I wish in the emergency room we had music for patients on eye shades, because I think it would make it a little bit more pleasant for them. But in the clinic setting, it's just a different setting. It's all about set and the setting. And the setting and the set really prepares the patient, the individual, when they're coming in to be ready to delve in and get deeper in their own mind, to do like a self therapy, or as you guys said, for that reset button, to get that. And immediately after their session, they feel light and peaceful. And they're just some clients that I've had, they're energized, they're ready to go tackle the world. It's amazing to see that.
Yeah, amazing. And speaking of safety, what do you do at your clinic to maintain kind of the high standards of care, high quality, and to ensure their safety?
Making sure checking vitals in at the beginning and mid and at the end, just to make sure that they don't have that rebound tachycardia or hypertension. Really was the most important. Doing the intake process, I do the same thing, and getting their vitals beforehand, just to know where they're at before they even have that anxiety, because anxiety is going to make your blood pressure go up. So when they're coming in for consultation, they might not have as much of an anxiety as the day of initial infusion. So just knowing where their baseline is, and really making sure that the patient is going to be safe and also having backup. So oxygen, having the AED, having bag, bag mask, and also 911.
Yeah.
Calling
100%.
911.
100%.
Yeah.
And as you're speaking, I'm also want to acknowledge that you're an emergency physician. So, you may have BVM or someone may have various AED, but if it's
Right.
like, well, it's not necessarily just the tools, but actually the individual, like that you yourself, because of your unique
Right.
skill set, like that presence, I would say I make up would be very comforting for patients, like, hey,
Right.
I have someone with, a decade of experience or whatever it may be, like just, having me for backup. I think that's reassuring.
That I think so as well. And just letting them know of all the common side effects that they might feel ahead of time, just to put their mind at ease and acknowledging that, yeah, you are going to be feeling anxious and that's okay.
And now a quick word for our aspiring ketamine clinic founders out there. If you've tuned into our episode today, chances are you're curious about the ins and outs of starting up a ketamine clinic. It's an exciting field, but let's face it, the journey from idea to actually opening day can be quite daunting. That's why we've created something special for you. Think of it as your personal roadmap, a free downloadable checklist that lays out the essential steps you need to consider when starting up your own ketamine clinic. This checklist is designed to help you avoid common pitfalls and launch your trajectory to success. So how can you get your hands on this checklist? Simple. Just visit www.ketaminestartup.com/checklist and grab your free copy today. We've made it easy and accessible because we believe in supporting our community with valuable resources. ketaminestartup.com/checklist. All right, let's get back to our discussion. Stay tuned and don't forget to download your free checklist during or after the podcast. As your clinic has grown and developed, what strategies or approaches have you found to be the most impactful for its success?
Some of the strategies is really it's client centered, is patient centered. So not everybody's the same. One person, it might work for them. The next person, it might not. Kind of keeping the expectations where it's at. Don't giving them high expectation and then for it not working. And then they're like, well, you set the expectation high. So not to disappoint them, but also letting them know, this is a treatment. It's not a cure, as we've learned so far, and making sure that if the client needs more, to give them more. If they need less, to give them less, and just kind of talking through them. Communication, keeping an open dialogue with the clients have really helped me get this more individualized.
Yeah. So it sounds like kind of setting the expectations, preparing the patients, having that open dialogue.
Yeah.
Because I remember I'll have patients reach out to me at our clinic and they're like, yeah, I'm going to get 6 treatments and I'm going to be cured. I'm never going to feel sad ever again in my life. And it's like, yeah, that's probably, it could happen, pretty rare. But I think under promising and over delivering is better than over promising and under delivering.
Absolutely.
Are there any tools or partnerships that you have that you can't imagine running your clinic without? Like, is there anything that you're like, man, I really appreciate having this or that tool or this connection with this individual?
I think that having taken the course from Ketamine Startup was absolute, like, it was so helpful. And the fact that I know I've reached out to you multiple times on different things because just different things come up at different times that maybe I didn't pay attention to and maybe didn't come up and I didn't have questions at that time a year ago, but now I have questions. So having you guys as my backup, as community, just being part of the community feels great.
Thank you. And we didn't plan that in advance. So thank you for saying that. Really appreciate you. Okay. So here's another question that's kind of aimed at, I had written the question, like, what advice would you give to someone else who's interested in starting a clinic? But I'm going to shift that question. What advice would you give to yourself 2 years ago, 3 years ago, that if you're like, hey, looking back at that former past Dr. Imani, what advice would I give her 2 years ago that you know now?
There's a plot twist right there. I would think, I do have to think about this because I was just thinking about what advice I would give to somebody else. And I would probably that would be the same advice to myself, would be, if you're going into this, you're not going into this to get rich. You're going into this to help people. Remind yourself of that. I mean, yes, we don't, I mean, I still need to be able to pay for the cost and pay for my time that I'm not working clinically. But at the same time, just helping people and how much does that, like the satisfaction and like the happiness that brings me. I'm happier doing this. And at some point I was happy working in the ER and I still have those days, but I'm just happier now because I know that I can help in a different way. So just starting sooner and getting things together. It took me a while and I think it's totally fine because things kind of worked itself out. And I was looking for ketamine clinic about a year ago and I couldn't find anything. And it just happened that now I'm at a really good spot and I'm loving where I am right now.
Yeah. And what I appreciate about that is sometimes someone who doesn't know about the ketamine space quite yet, they're like, I'm going to go make a bunch of money. It's cash pay. I'm going to, be able to retire on this. I'm going to be able to work 4 hour a week and just enjoy it. It's like a lot of work and it may not be as lucrative as the traditional clinical job. I remember for me, when I was starting out 6 years ago, like I had an opportunity to be a medical director of a ED and it was quite high compensation. And I had to make a decision like, do I do this, which has financially very rewarding, but emotionally, spiritually not rewarding. And I think that emotional, spiritual nourishment that, it sounds like we both receive from treating patients, like that's priceless in a way.
That is so true. And I had a similar event that I was about to take a job that I was going to be a medical director at a facility that we had to move cities and that was going to be high anxiety. And I thought about it and I'm like, that's not going to bring me that gratification of me being able to have my own clinic and treat clients and bring them happiness. That just brings me happiness. So it was totally worth it.
Yeah.
That I took this route instead of the other route.
Yeah. And on that note, it's also, you have mentioned like being the owner. And I think there's a lot of power behind autonomy. I know when I used to work in the like I work for one of these large corporate management groups. I won't say their name, but they are going bankrupt or filing for bankruptcy. And it was so many layers of administration, so many meetings, committees. And I've given this example before, but there was one time I wanted to order a chair for the physician documentation space. And I was like, yeah, I'm going to order a chair. Can we go? And they're like, oh, we have to run it by the committee and we have to find out exactly what type it is. And why don't you come up with an idea and then we'll bring it up to the committee and we'll let you know in 3 to 6 months about whether you can have a chair. I'm like, are you serious? 3 to 6 months? I will buy one on Amazon. I'll pay for it. Like, I'll get it here in 2 days.
Much faster.
And now as owners, we have the autonomy. And I think that's also another thing that you can't really put a price on, setting your own hours and making decisions.
It is priceless. The hours, the time, I decide where the money goes or what do I want to invest in and what do I want to have in the office. What do I not have a waterfall in the reception area? And I just love that sound. It's just very peaceful to me. And I've had most of my clients that have come in, they always comment on it. They're like, oh my God, that's so nice. I'm like, I know.
Wow.
I can't have that in the ER.
You cannot have a waterfall in the ER. You'd have to run it by the committee.
They probably would turn it down.
Yeah, and there might go in there.
Yeah, so you might get something. Legionella.
Yeah, totally. Let's see here. So personally, since you've began this journey of, opening and operating, in what ways have you personally noticed your mindset or personal outlook evolve? Like sometimes we help a lot of patients grow and evolve and heal. But for you, has there been a process of evolution in your personal journey?
Oh, absolutely. More mindful. Being just more mindful of the way you feel, the way and as long as you're not in a good place, you can't help somebody else. So learning how to reset myself first and to be ready to provide that area or provide that practice for the people that when they're coming in, this is how we're going to run this and just teaching them about mindfulness, about journaling. Mm-hmm. I just recently listened to a podcast about journaling and I didn't realize how important it was until you start writing things down and then you walk away, but then you come back 2 days later and you read it and you're like, oh, wow, I was looking at this the wrong way. Just that is mind changing to me. Yeah. I've never done that before.
That's awesome.
That's changed my practice.
Yeah, that's awesome. And yeah, I think there's something really powerful about journaling, taking my thoughts, putting it down on paper, actually seeing it, and then reading it. Although my handwriting is really terrible.
That's why I type.
Okay,
I type on
okay,
the screen.
you're typing, yeah. But I do recommend to our patients to journal. Like, it's a really powerful
It
process.
is.
And actually I don't know if we were listening to the same podcast, but was it the Huberman podcast?
Yes.
The method of
Yes.
writing about the traumatic event or the
Yeah.
stressful event for 15 minutes a
Yeah.
day for 4 weeks, I think. So
I think for
60
him, it
minutes.
was like you throw it away and then you just write the same
Just
thing.
write it again.
Yeah.
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 So rewriting the experience
Rewriting
for
the
15 minutes
experience.
or typing the experience
Right.
15 minutes. And yeah, it's really interesting because there's scientific studies showing can actually be therapeutic in itself.
That was an amazing podcast.
Yeah.
I
It was a
listened
good
to
one.
most of his podcasts.
Yep. Yeah, he has some really good content. I like his double inhale, exhale. Do you remember that one?
No, I don't remember that one.
He had mentioned that there was a study, and this is Dr. Huberman, so check out his podcast because his is really great. But if we're feeling stressed out, we take in a deep inhale, like, and then at the top of the inhale, take in one more sip of air, and then
Just calms your nerves down.
that calms nerves down, activates the vagus nerve.
Like as you were doing it, I was kind of doing it with you.
Yeah.
I had no idea what you were going to say next.
Yeah, it's supposed to like alter the dynamic between the parasympathetic and the sympathetic nervous system.
It's amazing.
So I'll actually do that.
Yeah.
And sometimes what I'll do is with our patients, and let's say their blood pressure is slightly high, 146 over 88. I'll have them do this double inhale, long exhale.
Right.
And then I'll wait. And I'll actually have them do it 2 or 3 times. I'll have them wait 3 to 4 minutes. I'll recheck their BP. And it drops down into normal range. Their heart rate drops down into normal range. So it's kind of a
I'm
fun
going to use
little
that. I'm
tap.
going to have to use that next time for sure. But he has another podcast that I had listened to, the initial podcast that I had listened to, and that's how I come to know Huberman is the Ketamine podcast.
Yeah.
The risk benefits. And it was just, I had to listen to that 2 or 3 times. So dense, but so good.
Totally. Yeah, that was a great episode. I'm glad he talked about it. And what I like about it is how scientific based it is. Because I like the woo stuff. I'm in California and crystals and aromatherapy, but I also like the science and mix per kg and vital signs. So kind of a nice
You're
balance.
a scientist at the core.
So I'm curious. I want to hear a little bit about your patients. Like, is there one patient story, someone that you treated recently or a while ago that kind of epitomizes your approach to patient care and kind of their results?
Oh, yeah. I think my second client, I have a couple. One of them was like, I just want to see, it's just more curiosity. But yeah, I might feel a little depressed, anxious. I don't want to get out the house. But then she did the first session and I didn't think this, I thought she was just going to do one session just to kind of see what it's like. And afterwards, we did 6 sessions later and she was like, wow, I learned some things about myself that I didn't even think it was there. And it just kind of came up. And I'm so glad that I did this kind of self-discovery and it helped her so much. Another one that I'm going to quickly just tell you about is she was my second client who has had so many things going on in her past and everything that she has dealt with and being also with her job as a first responder. She had so much going on. She did 3 treatments and for whatever reason, had to take some time off. She didn't come back. 2 months later, she messages me and she says, I'm ready. I need to come in for a booster. And I'm like, but we never finished the 6 sessions. What do you mean booster? She's like, ketamine has changed my life. Ketamine has changed. I'm like, that for her, it only took 3 treatments. We didn't have to do all 6. So now we just do boosters. She came in, her mood was uplifted and she was just totally different person. She was giggly. She was just lighthearted and she's now dating someone. And it's just everything about her was, I hadn't seen her for 2 months. And I was like, who are you?
Wow.
What have you done with the person that I had met and have known for the past years? Just amazing results.
Transformational.
Amazing transformation.
Wow. And that would not have been possible without you.
No. And she had tried a lot of different things. She said that pretty much I'm at rock bottom. This is it. Ketamine, I've been looking at it, I've been reading. And I like the patients that come in and they have been reading about it. They have been looking into it and listening to podcasts because they come in well informed. There's nothing much that I can tell them other than, hey, this is how long the infusion going to be and this is what we're going to do afterwards. But just amazing transformation.
Yeah, I feel like those are some of the best patients that I have who have read the articles and who've watched the videos and they're like really well informed. And so I asked them like, do you have any questions for me? And they're like, nope, I've done 6 months of research. I know exactly what I'm getting into. I watched your videos. I watch other videos. I watch documentaries. And so when they come in informed, kind of knowing what to expect, I find it to be much easier transition.
Oh, absolutely. I have another client that recently treated that. He's been looking at this since 2018.
Wow.
He's been looking at it and kind of wanting to do it, but for whatever reason, it just wasn't the right time. And so glad that he's done it now.
Beautiful.
Yeah.
I know you're juggling many things because you're working, family, a business owner, an entrepreneur. How do you strike a balance between running a successful clinic and then at the same time ensuring your own well-being?
It's hard, but having a solid partner helps. My husband, he helps me with our kids. He helps me. He's my operations director. The backbone pretty much. So if it wasn't for him, I don't think I would have gone this far because he's the guy that I run things by. So just having that and just every now and then having a reality check. Hey, we do have a lot going on. We do have the activities for the kids and I have to do my full-time job still and I'm running a clinic. So there is some sacrifices that we make, but at the same time, I think it takes both of us to work together and really acknowledge that, okay, this is a high stress situation. What can we do to take steps to, maybe de-stress a little bit?
That's one of the common themes I've noticed is I've done a few interviews already, and when I'll ask them, they'll say, yeah, having a good partner. My husband he's a chef and he'll make the food for us when I come home, and just having someone, because doing this alone is hard. And I think having support, whether it's our partners, husbands, wives, boyfriends, girlfriends, staff, like all of this, we can't do this alone.
Right. Having support and community and people that know that you can go and ask questions, being at this conference and being able to ask any questions, why do you do it this way or why do you do it? And just learning.
Yeah.
Keep learning.
Yeah. Yeah. And I don't know if I mentioned this, but we are at the American Society of Ketamine Physicians, Psychotherapists, and Practitioners ASKP3 conference in Austin, Texas. It's a great organization. Would highly recommend people join because it's the only national organization that is open and available. So serving kind of the entire community. And actually they're international because I've met people from Brazil. I've met people from Australia. So it's not only the US, but international as well. So we're going to switch it up and do some fun questions as we kind of get near the tail end of it. So this is one that it's regarding a deserted island. So let's say that you can only have one book, one movie, and one type of food with you on a deserted island. What would they be?
House of God. Have you read that?
Yes.
Okay. House of God. Movie, the first one that comes to mind is Matrix for whatever reason. That's just my go-to movie. And then food, pizza. I can eat pizza.
What's your favorite toppings?
Probably I would do the margarita pizza, but my husband always wants the meat lovers. So if he's on the island, we would have to get one of each. If he's not, I would just go with the margarita pizza.
That's hilarious. When I was in high school, I actually worked at a pizza and pasta place.
Yeah.
So because I love pizza as well, and my first job was actually it was such a busy place. All I did was pull pizzas out of ovens and slice them up. I was I was known as the oven. They called me oven boy. And so that's all I would do is just slice pizza. But eventually I learned how to make pizza, how to make dough, how to throw pizzas, how to make
throw it up in the air.
I know how to throw it up in the air and
catch it.
It's a life skill. So
we have that in common. My first job was at a pizza place as well.
Okay.
Yeah.
What did you do? Did you
I answered the phone. No, I didn't learn the skills. I was just answering the phone and taking orders. Yeah.
Okay, very cool.
I was very young at that time. Yeah.
Yeah. And I feel like having the experience in customer service, in a way, like being a physician is customer service, very patient oriented. So it's
I always thought just
powerful.
Being an emergency physician is like being a waitress. You have to take orders, literally sometimes.
Yeah.
And then you have to make sure that, somebody is ready to go or they're going to, which way they're going to get this position. And, somebody else wants something else to add that on to their tab and keeping an eye on everybody.
Yeah, totally. I noticed that when I worked in the ER, I'm like, this feels like I'm working in a restaurant. Yeah. There was one difference for me is with the restaurant, I know it's going to close at 9 p.m. or whatever, 10 p.m. But with the ER, of course, it does not close And then we know we can expect the lunch rush, the dinner rush, but sometimes when I was working in the ER, like I felt like it was always a rush. And
Yeah.
no matter how many patients I saw, I would look at that waiting board on the computer screen and it's still like, man, there's 20 more people. I would always feel a little bit like not good enough. Like I'm like, man, I didn't see all the people. And,
Right.
but whereas in the restaurant, I'm like, cool. Like I know dinner rush is
Yeah.
over. We can chill out.
Yeah. But also in the restaurant, you would get tips.
That
You get
is
no
true.
tips.
That is true. That is very, it would be interesting if
Get
we
no
started
tips.
taking tips in the ER.
Yeah.
That would be a very different game. I'm curious for you, since you're juggling so much and, you know, whether it's a long day at the clinic, a long shift in the ER, what's your go-to way to relax and de-stress and chill out?
Oh boy. If I have the time or if I can really be mindful and make the time, which we try, is to really take a nice hot bath. And then afterwards, just sit down on the couch with my husband and talk about our day. Talk about our day and what happened, what's going on. Just because with kids, sometimes you don't have the time to even communicate because they're screaming or something is happening or you have to go somewhere else and you're just running around and juggling different things and answering emails or text messages that we just really have to be mindful to sit down and make time for ourselves. So that really is a way for me to de-stress and wind down.
Yeah, I love it. And like, I like the concept of the bath time. I was doing showers and I still do showers a lot, but there's moments where I'm like, you know what? It's a really tough day. I'll bring out the magnesium Epsom salt.
Nice. Yeah.
I think it's mag sulfate, and just pouring like a bunch of magnesium Epsom salt. And then someone gave me a tip of essential oil. So I'll put in like rosemary,
That is a
essential
good
oil, lavender, essential
Oh.
oil, and just sit in there.
Yeah.
And yeah, and actually
Yeah.
it's supposed to help us fall asleep too.
And I actually have essential oils in my treatment rooms. Like they can pick what they want, but most people tend to pick lavender.
Mm-hmm.
Oh, and it just fumes the whole room and it just smells so great. Just two different senses.
Yeah, it's definitely something we could use in
Yeah.
the ER sometime.
Oh God, yeah.
Right? Code Brown.
Absolutely. Yeah.
Do you have a hidden talent or hobby that most people would be surprised to learn about?
Mhm. Oh man, a long time ago, I used to own motorcycles and actually ride motorcycles until I saw enough traumas in the emergency room that I just not just look at it from afar, but love riding my motorcycle.
Wow. What kind of
Yeah.
motorcycle did
I
you
had a
have?
CBR 600. It was a yellow. I had it lowered because I'm not that, I'm vertically challenged.
Yeah.
So it was my favorite. And I look back sometimes and I'm like, how did my parents allow me to do that? I was
Wow.
18 years old and yeah, I was going back and forth from school and riding on a motorcycle.
That's pretty badass. I mean, as a stereotype and generalization, like you don't really see more men on
Right.
motorcycles. So it's
Right.
pretty.
I told my husband, I'm like, once our kids are grown, we're gonna get motorcycles again because at that point, you're like,
Yeah, you're good.
What do you have to lose?
Yeah. Yeah, you're good. The kids are taken care of.
Yeah.
I actually have a scooter. So
Yeah.
it's not quite the 600. I think it's like 200 cc. It's a scooter. It's like a Vespa almost. And
Vespers are nice.
yeah, I would take it just on the side streets, so not on the highway.
Yeah.
But the thing went pretty fast. I mean, I was like going 55, 60. And
how many minutes? I'm just
yeah, exactly. It was
how many seconds?
Exactly. It was super slow, but there is a thrill to being on a motorcycle. And maybe that's the reason we're in the ER because I don't know. Do you think
adrenaline.
there's like the adrenaline?
Yeah, I definitely do like the adrenaline.
Yeah.
I mean, I've taken when we started dating, my husband and I have taken him on some dates that was a little questionable, hang gliding and
Wow.
Yeah, the glider flights and figuring out at the last minute, oh, they don't have an engine. You just glide your way down. with a pilot that at that point you can't pre-screen him. So I saw the guy, I'm like, oh my God, he could have a heart attack in the air at any moment. What would I do? Like there's no parachute. He's just sitting there. And the guy was like, do you guys want to do something fun? And we're like, yeah, wait. Oh, too late. And he was like flipping us upside down. And I was like,
wow. So you actually bring up a good point. Like maybe, and I could be wrong, for people who start up ketamine clinics, maybe there is a bit of adventuresome or risk seeking or people who like excitement versus someone who likes things very stable and they're like, I don't like change. maybe that is an important value or trait.
I think so, especially since as ER doctors, I always say I'm a risk stratifier. You know, you look at risk, you look at, okay, can I send this patient who's coming in for chest pain home, or do they need to be admitted? You're risk stratifying all day when you're at work. And I think that starting your own business is taking a risk, you know, because there's so many unknowns. I know that we had so much anxiety before we had signed the lease because we're like, what if this doesn't take off? What if this doesn't go anywhere? What if we don't do well? I mean, there's so many what ifs and so many unknowns. So there's taking the risk.
Taking the risk, yeah. It's a leap.
Yeah.
And especially when we do have that comfort of having a reliable job and salary. I think it was Nassim Taleb who said the two most addictive substances are heroin and a monthly salary. So it's like, there's definitely...
Or meth for some people.
Yeah, or meth, depending upon what state you're in. Yeah.
Heroin or meth, depending on what state.
And cocaine, I guess, and meth. And some addictive substances.
Depending on the region.
I'm curious. So this is kind of a time travel question, but let's say that you could go back into history, any time period, any location. Where and when would you go and why?
That's the easy one. I would go back. So at a period of our past, we lived as refugees in Austria, Vienna, for about 6 to 8 months there before we had our paperwork ready to come to US. And even though we were refugees, I mean, it didn't feel like it because you were in Europe. You was a teenager in Europe, and I didn't have to go to school, and it was the best time because you would just go to parks and you just go pretty much walk, and you have different things to do. And we'd go to swimming pools where there was literally no fee to get in. So that was great. Like being a teenager in Europe at that time, getting on the train and just going to different, but just living, just, free, fierce, of the world, and not having to worry about what do you have to do, what are you responsible for, the job, and what do you need to do tomorrow, what's your agenda, the meetings and everything. So there's none of that at that time.
Wow. What's so fascinating to me about hearing this experience is when I hear the word refugee, like I think a lot of hardship, which I probably, it was, but the fact that you would go back to that time period, I think that says a lot about you and your resilience and your ability to shift your perspective.
It just reminds me to be grateful, of everything that I've been given so far in life, being in America, being in US, being a female, and being able to be a physician and helping others. It's just the gratitude is huge.
Yeah.
Being grateful.
That's so awesome. Yeah. It kind of reminds me of this concept, like when we know how low things can be, that helps us appreciate the beauty of life. Like the deeper sorrow that one can experience, that means that the deeper joy that one can also experience as a possibility.
Absolutely.
Yeah, both those ways. For some reason, let's say that you could not be a physician anymore. You couldn't be a ketamine clinic owner. You could not even be in the healthcare space. And so if you had to pick a career, something completely different, can't be a doctor, what would you do instead?
Stunt woman.
Of course, definitely stunt woman.
And lots of adrenaline and adventure.
Wow. Okay.
Yeah.
Awesome. And I can see you doing that.
Yeah.
Yeah. Stunt woman.
I don't know how long I would make it, but that's what I would want to do.
It seems to fit with the whole theme for you, of the adrenaline, having fun, doing wild things. And just hearing about your dates with your husband, like that sounds pretty epic.
Yeah, and he still decided to marry me. So
yeah, awesome. Well, maybe he likes it too. Let's see. So as we wrap up, is there anything else? Any other last thoughts, comments, questions, complaints?
No.
That are coming up for you?
No, not that I can think of.
Okay. Yeah. And with that, where can people learn more about you? Do you have social media? Do you have a website? Like, what's the best way? I do.
My website is www.nameeninfusion.com, or I'm also on Instagram as Nameen Ketamine Infusion.
Okay, great. And it's Nameen Infusion.com. And what we will do, we promise we'll link it in the show notes so that if people are curious about it, can check out Dr. Imani's website and learn more about her and stay connected.
Yes. Thank you so much for having me.
Thank you so
Thanks.
much. Appreciate you.